When you wake up in the morning, you eat before brushing. I think there is kind of a surprise because a lot of people now, if they wake up, they will brush before eating. But if you brush in the night, then it's expected that it's wise that you brush when you must have eat taking your breakfast. Tooth is kind of a gateway to your body, and if you take care of your tooth, you smile very well. Excuse. And a lot of people don't know how to take care of their mouth. Most starting from even brushing, most people don't know how to brush. But one good thing is that if you know how to take care of your tooth, you will not suffer from toothache till you die. If you check, tooth is kind of the strongest bone in the human system. You can check it, you can check that. But a lot of people doesn't take care of their tooth. Before you know, they start complain about toothache, tooth many things, calculus, halitosis. Halitosis is mouth odour. You all know about all those things. So it's expected that you should brush twice every day. You brush after eating your breakfast and brush when you're about to sleep. That's after taking all your dinner, eating everything you want to eat, then you brush and go and sleep. When you wake up in the morning, you eat before brushing. I think there is kind of a surprise because a lot of people now, if they wake up, they will brush before eating. But if you brush in the night, then it's expected that it's wise that you brush when you must have eat taking your breakfast. Then, like I said earlier, when you brush, when you're taking care of your tooth, then that is one thing. Secondly, a lot of people don't used to visit their dentist. You know, you're supposed to visit your dentist twice every year. The dentist will help to, there's something they call a scaling and polishing, S&P. You do S&P, your dentist will help you to do your S&P. In a dentistry, you have many departments. A dental therapist will help you to do that. We do S&P, that is scaling and polishing. Hence, you're able to do your scaling and polishing twice every year. You will never have a toothache till you die. But you see, many people will have cold, the hole will keep on increasing. They'll be like, the before you know it, the toothache will start from a little, and the thing will come maybe within a day. And after a day, they will kind of go and take a pain relief. The thing will reduce. Then after a while, they will see have the ache without even going for examination. They will go to a chemist or a pharmacy to buy the all this anesthetic drug for them to relieve the pain. Without knowing that, I have been telling people that all this anesthetic drugs, pain killer, all those things doesn't help in toothache. You have to treat the cause. There is a cause. It's kind of a sign telling you that something is wrong in your oral system. Something is wrong. But a lot of people kind of ignore it, taking medicine. After everything, the thing will still come. So, and before you know, the thing will keep on increasing, and before you know it, you will have to spend a whole lot of money. Sometimes you have to remove even your tooth. So, but if you notice the sign earlier and you're able to address the problem, then you'll be able to kind of settle it and help yourself, because it will affect you even from eating, smiling, speech, all those things. So then, from the whole, like I said earlier, when you recognize the signs earlier, it will help you to the pain will not be much, even though it will not cost you much, because S&P, I don't think it will cost more than 20,000. It depends on your location. It depends on your locations. Then after the when you're able to do your exam, but if you are not able to do it, if you kind of notice any sign of a toothache, it's expected that you visit your dentist. But if you fail to do that, then the whole thing will start to increase, will tend to increase, and before you know it, it can lead to tooth decay. Tooth decay, there's something we call a calculus. Calculus is kind of a dirty in the that is a layman understands, a dirty in the tooth. It's called calculus. Then if you're able to remove, if you are not able to remove those things, the thing can cause a tooth decay, then which can cause a hole. And the hole, the extent the hole will reach, it's kind of, if it's not all that much, you can fill the hole or you can remove it. Removing is the last thing anyway in our profession. If we are not able to take care of, if you cannot kind of maintain the tooth very well, then you have to remove the tooth. Then after everything, we are kind of, we can be talking about the denture, how to replace tooth, because when you remove your tooth, it will help in speech pronunciation. It helps in beauty, because if you remove your tooth, the whole gums will collapse, will not be beautiful. So it will kind of affect your beauty, affect your speech, affect your the way you you eat. Because if and when you are not eating very well, then it will affect your whole body system, because you start shrinking, the diet, everything will not be complete. You know, you expected you take a balanced diet. Then it's expected that when you remove your teeth, or maybe accidentally, because you can lose your teeth either accidentally or by diseases. So if you remove, it's expected that you replace it. So I don't know whether I have answered your question from now.
Thank you very much. Then another question I want to ask is that, is there any tooth disease that can be hereditary? I don't know whether.
Okay, in terms of heredity, we have a different colors of tooth, and the thing where many people will be like, please, I want to do tooth whitening, I want to do this. Oh, it's good though, but I'm not advising it. I still have a little side effect, but still know that you have a different color of tooth, and maybe your tooth color does not determine that maybe you are not suffering from toothache or this thing. So, from your questions, is not. Can you remind me your question again?
Okay, okay. Is there okay, okay. My question is that, is there any like tooth disease can be hereditary, maybe transferred from one generation to another?
Okay. Just like I wanted him to kind of stress on it very well, because for us to understand this, like I said about the color of tooth, it depends. That one is hereditary. Then there is kind of a color of your tooth that is maybe resistant to some of the bacterial diseases that might kind of lead to tooth decay. But to answer the question very well, is tooth a problem? If you're able to take your very good care of tooth, I don't think hereditary plays a lesser role on it. It have kind of, let me say, contributes something like 20% or 30%. So if you're able to take care of your tooth, it help to reduce tooth decay. Then another thing depends on your location, the diet you take, the water you took. So it depends on it. They can even help on the tooth. So it depends on the diet you took. So heredity plays a lesser role. The most important thing for you to take care of your teeth. I don't know whether I have answered your questions.
Yes, I've answered my question. Thank you very much for this video. At least you have great awareness, because there's many information you just give me, and this is my first time of hearing such information for the first time, especially the one you say that if you brush before sleeping at night, maybe in the morning, you're supposed to brush after eating, not before eating. So I'm very grateful for this type of information, because this is my first time of hearing such information from a professional for the first time. Thank you. Please, you audience, I would like you to press like and subscribe button. It will help in the YouTube algorithm. Please subscribe and comment. Thank you. Yeah.